National In Charge Policy BJP Wing, to give her special address. Over to you, ma'am.
Thank you very much. Good afternoon to all of you. It's my pleasure to be talking here at this forum. I have not been keeping well. Last night was a very bad night. I had migraine, so you must forgive me if I'm not as energetic as I normally am. So give me that room to be a little dull today. Now this topic on inclusion, my friends. Inclusion is a very, very complex and a complicated topic. To give an example, you ask any doctor, a practicing doctor, he'll say that lack of disease is not health. Lack of disease is not health. And likewise, lack of exclusion is not inclusion, because inclusion has multiple facets. It's extremely complex and complicated. And if any organization is trying to attempt at including either women or the disabled, they have to really understand the nuances of inclusion. Now, let me give a couple of examples, especially from the area that I work. Now, before I do that, I want to just alert you to one very important thing. Year on year at the World Economic Forum, all these hundreds of leaders from across the world congregate and they speak about what we call as the gender gap report. Gender gap report is essentially comparing men and women against 4 parameters. The first one is education, health, economic empowerment, and political participation. If women and men are doing same, almost close to one another, neck to neck, then the economy is growing very well. They say the bigger the gap, economy is slipping. So our country has had not a very great track record of that gap. So we have to be very alert to that. Now, look at the inclusion part. As I said, it's not as easy as we look at records or reports and understand inclusion. I just give you examples from my own workplace. I remember in the year 2003, 2004, I was driving a visioning exercise for the city of Hyderabad. It was a World Bank project and I was leading that visioning exercise for the city. So I thought, let me include everyone. And I called the senior citizens, I called the women, I called geographically, people spread out geographically. So I thought I included everyone. And when women came, we asked them, what is it that you would like to have in the city? And most women said that they would like to have continuous water supply. They'd like to have clean toilets. These are the requirements. And I thought I was happy that I included women in that. But as I said, inclusion is complex. And if you don't get technical help to understand how to actually include, you end up making mistakes. So now let me share the example of what happened in Vienna. Vienna is the only country that wanted to look at city planning through the gender lens. So they started asking men and women as to how they use the roads. Men said, how do you use the road? So men said, we go to office in our car and we come back, maybe go to the golf club, come back, maybe go partying, come back. But when they asked women said, in the mornings, they take their pets for a walk. And after a while, they come back and they take their children to schools. Then after that, they come back and see if there is any need for a senior citizen to be taken to the hospitals, which means they are using wheelchairs. Then they also said they might have to go to the grocers, which means they're using a truck. So women were using the roads, the streets in much more different ways than men, and using a gender lens to include women in city planning. Vienna has done phenomenally well. So as I said, these are some of the examples. Another example I'd like to give is very interesting. This is about when India wanted to plan and build affordable homes. Government put a stipulation and said, anyone who's building gated communities should include the poor. So 20% of the homes were reserved for the poor. And there was a big furor. People didn't want the poor to stay in the gated communities because they thought they were exclusive. Then they started thinking about it and they said, yes, why not? Because my maid comes from that locality. She'll maybe reach my home faster. So let's do inclusion. But this is not a, what do I say? It never came from the heart, but they had to do it. So they went and did this bit of inclusion. Well, the third one is recently I was talking to a transgender woman. She was telling me, she said, ma'am, the complexities of including us, because I'm working on a very special program with them. And she said, in our own families, when we are born, they try to, supposing I look like a man, but I choose to go the woman way because inside I feel like a woman. They put pressure on you. They say that you stay in the house, they're including them in the family, but they're including them on one condition, that she behaves like a man. So this is conditional inclusion. Now I can go on giving a whole bunch of examples. Recently, I was flabbergasted to read the NCRB report. This is the National Crime Records Bureau report, where the assaults on women have gone up exponentially. 46% of the women got assaulted and they were raped. Most of them happened in joint families by either the husband or the relatives of the husband. So when we give away a woman, we say that, wow, she's going into a family, she's being brought into the large family, being included in the game of family life. But you find that it's a little hazardous. I'll give you another hazardous example. I remember 20 years ago, we were working on giving toilets to women on the streets. I remember creating grids for every city that we advised and said that you need to create this many number of toilets for women because we wanted to include them. How long will they hold their bladders? So, but what happened was the nuances were not understood. We wanted to include, and finally what happened? Some of the toilets were used to actually rape women. So as I said, inclusion is a brilliant concept, but if you don't look at it scientifically, you end up not including people and actually creating hazards for them and creating problems psychologically, physically, and physiologically. That's point one. Now, take a look at what's happening in India. The canvas is much bigger, and we are discussing this now. You're talking about, I heard Kanta Singh talk about how companies have to be empathetic. And the second speaker, Nish, also spoke so brilliantly about accommodating. Now, look at India, where we are today. I don't know how many of you know that India today, 42% of the STEM graduates in India are women. Just imagine 42%. And what is STEM education? Science, technology, engineering, mathematics. Highly professional. And they're all women. 42% of them are women. We beat United States of America. We are way ahead of US. We are way ahead of UK, Germany, and France. But what's happening to our women? They are educated, but they are not in the workplace. So today, if you look at the records, you find not even 9% of women are in the boardrooms. Not even 10% of the startups are run by women. I remember being a jury at one of the commerce industry awards, and we gave away awards. And there these women who came and took the awards. So when I asked them, it was a pharmaceutical company, and I congratulated her, and I asked her, you're doing so well, and how did you land on this API? And I was asking her technical questions about her pharmaceutical drugs, and she couldn't answer because somebody else was running the business for her. So in India, that still continues to happen. And another important thing to note, my friends, this you have to really stay alert to this, is 60% of the women in India between the ages of 15 and 60 are full-time working at homes. So they don't have a profession, and 60% of women are not in the workplace. And today, when our Honorable Prime Minister says that we need to see what we call as women-led development, I'm sure some of you have wondered what is the difference between women development and women-led development. So far in our country, we have seen what is called women development, which is nothing but you look at a truck, visualize a truck. The leadership of the country, the government is taking the truck, and then women are seated in equal numbers as men and given equal treatment. So that is women development. No discrimination, they're being treated well, so that is women development. But imagine a truck that is being driven by women and the country is in the backside. That is women-led development. Now, this is the vision that our Prime Minister has, and for which many things have been done for inclusion. Now, today is the first day you open the newspapers and you find that for the first time in the history of our country, we have changed the sex ratio. Always we had more men and less women, maybe because of abortions, etc. But now today, the beautiful news is that it is skewed more towards women. Our Prime Minister also thought of many things like Poshan Abhiyan, which is most of the women are anemic and therefore we have stunted children. It took us a whole lot of years to raise the stunt, to give nourishment to the children. So we are continuing to work in that area. Jan Dhan accounts. You would know that today my mate tells me, if you don't have cash, transfer into my account. I mean, practically everybody has an account, and that is financial empowerment and financial inclusion, which has been happening so brilliantly in our country. Now, let me conclude what I have to say about how inclusion has to be approached and how priorities have to be set. Let me give one example. Back in the year 2000, I'm sure Kanta Singh would know about it, that many world leaders got together and articulated what we call as the Millennium Development Goals. They were lofty goals, and they were put there to push the economies forward. And what were the goals? The goals were, the first one is about poverty alleviation. The second goal is about giving elementary education to people. The third one is maternal health. Just take care of, give maternal health. Fourth one is manage infant mortality. Let no child die. Fifth one is about gender equality. The sixth one is about HIV and communicable diseases. The seventh one is about environmental protection. And the eighth goal is about global partnerships. Now, so loftily, so brilliantly worked out. Every country went away home. Like today, we are looking at the Sustainable Development Goals articulated at COP21 in Paris. Like this, they went away, all the leaders, thinking that we'll achieve all these goals, pushing the countries forward. But if you see the records, none of the countries achieved it well. Now, I was reading a report recently saying that China achieved it. And now China is something, I'm not going to buy the dubious data of China. So let's believe that nobody really achieved it. Imagine why it was not achieved. If any thoughtful leader would have thought of only one goal, addressing one goal, they would have achieved all the others. How's that? Look at women empowerment. That is the fifth goal. If they had paid close attention to that, an educated, empowered woman, will she allow poverty to enter her home? Today, research says that if women earn money, they're going to put it right back into the family. They're going to give better nutrition. They're going to buy better clothes. They're going to educate their children, etc. Whereas a man might want to buy a fancy car, might want to buy a piece of land, whatever. So if educated, empowered women, poverty alleviation would have been addressed. The second one is about giving elementary education to the children. She would have definitely done that. The third one is about maternal health. Anemia, women, now after giving birth, will have several problems, not only just physical problems, she might even have postpartum depressions, etc. Any educated woman would know how to deal with that. And the fourth goal is about infant mortality. In India, children die before they touch the 5th year. Now, why are they dying? It's nothing but infectious diseases. Unfortunately, India still has the infectious disease burden. All it needs is just giving oral rehydration therapy, which is nothing but take some water, put some salt and sugar, and keep giving the child and maintain it. This is what I'm having because I'm suffering from severe migraine and vomitings last night. That's an educated woman would certainly know that. And the sixth goal is about HIV communicable diseases. Don't you think an educated, empowered woman would know how to manage her sexual status? The seventh goal is about environment protection. Today, what are we saying about environment protection? Reduce, reuse, and recycle, right? Now, women, don't you know, at home, you look at your mother. Is she going to throw away her old saris? No. She's going to pull them back. She's going to make a pillow out of it or a dari out of it. They are going to recycle. Women recycle like nobody's business. In fact, the largest business of recycling I've seen in Thailand, where it was headed by women. Imagine if women were empowered, they would have addressed even that goal. And the last one is global partnerships. I remember in the year 2001, I was addressing an international conference of women entrepreneurs and discovered that women, given the simple opportunity of networking, would brilliantly network and take it to any level. Today in the corporate sector, I remember I worked on diversity quite extensively in the corporate sector. And I remember the whole conversation that happens in the big companies where they say that women are excluded from the informal networks, where you have the bro culture, hi brother types, and also the alpha male. All those things actually might happen here, but if you empower a woman, she's going to penetrate those networks. So this is something that the world leaders failed looking at, and today we have to see it, be it in the corporate sector or in the country. Let me conclude by saying, if women work in equal numbers as men, the country's GDP will go up by 27%, a whopping 27%. And if 10% of women become healthy, today women have all kinds of problems, health problems. In fact, they have not only NCDs, non-communicable diseases like cancer, diabetes, heart attacks, etc. If 10% of women get better, India is going to India is going to save $700 billion, which is nothing. Translated, it stands at 21 lakh crores. Just 10% of women becoming healthy, going to the workplace, earning salaries, putting it back in their families, and then paying taxes. $700 billion, my friends, 21 lakh crores. So this is how powerful addressing women issues is. And inclusion is a great concept. And as I said, it has to be approached very scientifically, technically, looking at all facets of inclusion and attempting it both from the government side and the corporate sector side. So I'm trying to work on the government side, but I plead and appeal to all of you from the corporate sector, do whatever it takes to bring women into the mainstream. Don't let them stay in the periphery of workplace. Thank you very much.
Thank you, Karuna ma'am, for the wonderful insights, social, technological, economical, and all administrative aspects you have given, and the statistics around it. Thank you once again.